Hey, everybody, and welcome back. Today, we are taking a deep dive into something I bet you haven't thought much about before. We're going to be looking at the effects of smoking and alcohol on your oral health.
Yeah.
We all know that those habits aren't exactly, health food approved
Right.
in general. But the thing is that they can really mess with your mouth in some surprising ways
Yeah.
beyond just staining your teeth. So are you ready to uncover some of these hidden truths?
I think it is fascinating how a lot of people, they just focus on the general health risks
Right?
of smoking and drinking, but they don't realize that there's all this damage going on
Yeah.
right inside their mouths.
So let's unpack that damage then.
Okay.
We'll start with smoking.
Sure.
I get that it stains your teeth, but what else is going on? What's the real damage?
Well, think of smoking as like a sneaky saboteur,
Right.
just chipping away at your mouth's defenses.
Okay.
It starts with nicotine and tar. I mean, they deliver a 1-2 punch. Staining your teeth, that telltale yellowish brown. But here's the thing that a lot of people don't realize.
Okay.
Smoking actually dries out your mouth.
Wait, really?
Yeah.
I would have thought all that smoke would make your mouth more moist.
It seems counterintuitive, right?
Yeah.
But saliva is so crucial. It's like your mouth's natural cleaning crew, constantly washing away food particles and bacteria. Without enough saliva, you're not just battling bad breath from the smoke itself.
Right.
You're also setting the stage for cavities and gum disease.
So smoking is throwing a wrench in the whole system, like weakening my mouth's ability.
Precisely.
Okay.
And it gets worse.
Oh, great.
Smoking weakens your immune system overall, so you're more susceptible to infections.
Right.
And this includes gum disease. We're talking gingivitis, which is the early stage, and then the more severe periodontitis, which can actually destroy the bone supporting your teeth
Really?
and lead to tooth loss.
Oh, no.
Yeah, and in fact, smokers are twice as likely to lose their teeth compared to non-smokers.
That's a pretty scary statistic. I mean, I knew it was bad, but twice as likely.
Yeah,
That really puts it in perspective.
it does. And here's something else to consider.
Okay.
Smoking restricts blood flow. So if you need a dental procedure like an extraction or an implant, the healing process is going to be much slower.
Oh, wow.
And slower healing means a higher risk of infections and complications.
Okay, this is getting pretty heavy, and of course we can't forget about the elephant in the room.
Right.
Oral cancer.
Absolutely, we need to talk about that. Smoking significantly increases your risk of developing oral cancer. I mean, the chemicals in tobacco actually damage the DNA
Oh, wow.
in the cells of your mouth and throat, and that increases the likelihood of cancerous growths.
So it's not just like one kind of cancer either.
Right, we're not just talking about one type here. Smoking has been linked to squamous cell carcinoma, which is the most common type of oral cancer, as well as other less common but equally serious types.
So smoking is like a triple threat.
It is.
It stains your teeth, it weakens your defenses, and it increases your risk of serious diseases.
Yep.
All right, let's switch gears now and talk about alcohol.
Okay.
Is it any better for my mouth than smoking?
Well, while alcohol might not stain your teeth like tobacco does,
Right.
it comes with its own set of issues.
Oh, great.
And surprisingly, some of them mirror the effects of smoking.
Really?
For example, alcohol also dries out your mouth by interfering with saliva production.
Seriously. Another saliva saboteur.
Is.
So we're talking more cavities, more gum disease, and, more bad breath.
Yep.
I'm sensing a theme here.
You got it, but alcohol goes beyond just
Oh.
drying things out.
Right.
Think about all those sugary cocktails and mixed drinks.
Right.
That sugar is like a feast for the bacteria in your mouth.
Uh-huh.
They feed on it and they produce acids that attack your tooth enamel,
Okay.
which is that hard outer layer of your teeth, and that leads to cavities.
So it's not just the alcohol itself, but also what we mix it with
Right.
that can cause problems.
Yeah.
What about drinks like wine or beer, though?
Sure.
I've heard that red wine might actually be good for you. Is there any truth to that?
That's a common misconception.
Oh, really?
While red wine does contain antioxidants,
Right.
which can be beneficial for your overall health,
Right.
it's also acidic.
Oh.
And it can erode tooth enamel.
Okay.
And beer, while it's less acidic than wine, it still contains fermentable carbohydrates.
Oh, so those are bad too.
Yeah, bacteria can convert those into acids,
Uh-huh.
which contribute to tooth decay.
So even a glass of wine or a light beer can be damaging over time.
Especially if you're a regular drinker over time, yes.
Okay.
And like smoking alcohol also increases your risk of gum disease.
Really?
It causes inflammation in the gums, making them more susceptible to infection and bleeding.
So basically it's bad news all around.
Pretty much. And the risks don't stop there.
I have a bad feeling. I know where this is going. Alcohol also increases the risk of oral cancer, right?
Unfortunately, yes.
Yeah.
Alcohol is a significant risk factor, especially when combined with smoking.
Right.
The two together are a particularly dangerous combination
Yeah.
for your oral health.
All right. This is all pretty alarming.
Yeah.
What can people do about it? I mean, let's be realistic here.
You sure?
People are going to smoke. People are going to drink.
Right.
Are there ways to at least minimize the damage?
Absolutely. Even if you currently smoke or drink,
Okay.
there are things you can do to protect your oral health.
Okay, good.
I mean, the most important thing is quitting smoking. I know it's easier said than done,
Right.
but it's the absolute best thing you can do for your mouth and your overall health.
Right.
There are so many resources out there
Yeah.
to help you quit, so don't hesitate to seek support.
That makes sense. And what about alcohol?
Yeah,
I'm assuming moderation is key here.
definitely. Cutting back on alcohol, especially sugary and acidic drinks, can make a big difference. And staying hydrated is crucial.
Right.
Drink plenty of water throughout the day
Okay.
to help keep your mouth moist and wash away those harmful bacteria.
So basically, good habits still apply even if you indulge in these vices.
Absolutely. You probably already know the drill, but it's worth emphasizing.
Okay.
Consistent oral hygiene is your best defense.
Right.
We're talking proper brushing techniques twice a day,
Right.
daily flossing,
Yeah.
and ditch that alcohol-based mouthwash.
Oh, really?
Yeah, it can actually contribute to dryness.
Wow, I didn't know that.
And don't underestimate the power of regular dental checkups. Seeing your dentist every 6 months allows for early detection and intervention,
Yeah.
which can save you a lot of trouble down the line.
What about all those DIY whitening treatments out there?
Sure.
Are those safe to use? Especially if your teeth are stained from smoking or drinking.
That's a great question. It's always best to consult with your dentist first,
Okay.
especially if you have staining from smoking or drinking. They can recommend the safest and most effective options for your specific situation.
This is all great advice.
Yeah.
It's like damage control for your mouth, even if you haven't quite kicked the habits yet.
Right.
But what about the long-term effects, though?
Yeah.
If someone quits smoking or drinking, can their mouth actually recover?
That's a really interesting question
Yeah.
and one that deserves a closer look.
Okay.
We'll be diving into that and more in the next part of our deep dive, so stay tuned.
All right, sounds good.
Welcome back. It's great to be back to continue unpacking this with you. We left off on a really important question. Can your mouth actually recover if you quit smoking or drinking?
Right. Is there hope for redemption after years of bad habits? Can your mouth bounce back, or is the damage permanent? I'm ready for some good news.
Well, the good news is that your body, including your mouth, has an incredible ability to heal itself.
Okay.
Quitting smoking or cutting back on alcohol can lead to some pretty dramatic improvements in your oral health.
Okay, so there's hope. But how does that healing actually happen? What changes once you ditch those habits?
Well, let's start with smoking.
Okay.
When you quit, your blood circulation improves almost immediately.
Wow.
This means your gums start getting more oxygen and nutrients, which are essential for healing and fighting off infection.
So it's like giving your gums a breath of fresh air, literally.
Exactly. And over time, your immune system gets stronger, making you less vulnerable to gum disease. The risk of developing oral cancer also decreases significantly. It's important to remember, though, that it can take years for that risk to return to the level of a non-smoker.
So it's a journey, not an instant fix. What about the staining? Can those yellow teeth ever go back to white?
It depends. Some surface stains can be removed with professional cleaning and whitening treatments. But deeper staining that has penetrated the enamel might be more challenging to address.
Got it. So quitting can stop the damage and even reverse some of it, but there might be some lingering effects. Now, what about alcohol? Does cutting back or quitting have a similar impact?
Absolutely. When you reduce your alcohol intake, your saliva production starts to normalize, which is key for rebalancing the environment in your mouth. Remember, saliva is your mouth's natural defense system.
Right. It helps wash away food and bacteria, neutralizes acids, and even helps to remineralize your teeth. It's kind of like a superhero for your mouth.
Exactly. So when your saliva flow is back on track, you're less prone to cavities, gum disease, and bad breath. Reducing alcohol can also help decrease inflammation in your gums, giving them a chance to heal.
That is encouraging. Our mouths are pretty resilient given the chance.
They really are. But it's important to understand that quitting smoking or reducing alcohol is just one part of the equation. Maintaining excellent oral hygiene is essential for supporting your mouth's recovery.
So we're talking brushing, flossing, and regular dental checkups. The usual suspects.
Exactly. Think of it this way. You're giving your mouth the tools it needs to rebuild and stay healthy. And remember, even if you've made some missteps in the past, it's never too late to start taking better care of your oral health.
I love that. It's a message of hope and empowerment. But let's face it, sometimes life gets in the way. We get busy, we forget, we slip up. What advice would you give to someone who's trying to break bad habits but struggling to stay consistent with their oral hygiene routine?
That's a great question. I think it's all about finding what works for you and making small, sustainable changes. Start by setting realistic goals. Instead of aiming for perfection, focus on making gradual improvements. Maybe it's brushing twice a day instead of once, or flossing a few times a week instead of never.
So it's more about building the habit than being perfect all the time.
Exactly, and don't be afraid to get creative. Set reminders on your phone, keep floss in your car or purse for on-the-go cleaning, or try a fun new toothpaste flavor to make brushing more enjoyable. It's all about finding ways to make oral hygiene a natural part of your routine.
This is such practical advice. I'm already thinking about ways to step up my own game. But what about people who have already experienced some damage from smoking or drinking? Is there anything they could do to address those issues?
Absolutely. There are a lot of options available these days. For gum disease, there are treatments ranging from deep cleanings to more advanced procedures like gum grafting. For tooth loss, there are dentures, bridges, and implants. And for staining, there are professional whitening treatments that can make a big difference.
So it's not a lost cause, even if you've already seen some negative consequences. That's reassuring.
Not at all. Modern dentistry has come a long way, and there are solutions available to help restore your oral health and your smile. The key is to talk to your dentist about your concerns and explore the options that are right for you.
This is all great information. I'm feeling a lot more optimistic about the potential for recovery. But before we wrap up, I want to go back to something you mentioned earlier about the link between smoking, alcohol, and oral cancer. It's a scary thought, and I think a lot of people might be wondering how they can reduce their risk.
You're right, it is a serious topic. And the best way to reduce your risk is to avoid smoking and limit alcohol consumption. But it's also crucial to be aware of the early warning signs of oral cancer so you can seek treatment promptly if something seems amiss.
So what should people be looking for? What are the red flags?
Well, there are a few things to keep an eye out for. Sores in your mouth that don't heal, white or red patches on your gums or tongue, lumps or thickening in your cheek, and persistent sore throat or hoarseness are all potential warning signs. If you notice any of these, it's essential to see your dentist or doctor right away.
This is really important information. It's always better to be safe than sorry. Early detection is key.
Absolutely. Oral cancer is highly treatable when caught early, which is why regular dental checkups are so crucial. Your dentist is trained to spot these warning signs and can refer you for further evaluation if needed.
This is a powerful reminder that our oral health is connected to our overall well-being. It's not just about having a pretty smile, it's about protecting our health and well-being in general.
You hit the nail on the head. Taking care of your mouth is an investment in your overall health, and it's never too late to start making positive changes.
I couldn't agree more. This has been an incredibly informative deep dive. We've covered a lot of ground, from the specific ways smoking and alcohol impact our mouths to the potential for recovery and the importance of early detection for oral cancer. It's a lot to absorb. I'm sure our listeners have a lot to think about.
I agree. It's a lot of information, but it's empowering information. The more you know about how your choices impact your oral health, the better equipped you are to make informed decisions and create a healthier future for ourselves and our communities.
Well said. We'll be back soon with the final part of our deep dive, where we'll explore some of the social and psychological factors that influence these habits and discuss what we can do to create a healthier future for ourselves and our communities. Welcome back to the final part of our deep dive into smoking, alcohol, and oral health. We've talked about the science, the risks, and thankfully the potential for recovery, but let's be realistic. These habits are often, really deeply ingrained in our culture.
Yeah.
And in our personal lives,
True.
It's not always as simple as just willpower. There are often complex social and psychological factors at play.
Absolutely. I mean, we can't just focus on the physical effects without acknowledging those social and emotional aspects of these habits.
Right. So,
Smoking and drinking are often tied to social situations,
yeah,
stress relief, and even self-image.
right. People might smoke or drink to fit in with a certain group or to cope with anxiety or because it's become part of their routine or even their identity.
Exactly. And all of these factors can make it so challenging to break these habits, even when you're fully aware
Right.
of the risks.
Yeah.
It's not just about knowing the facts, it's about understanding those underlying motivations and triggers.
So how do we address those deeper issues then? Because
Yeah.
it feels like we need to go beyond just telling people to quit and start exploring the why behind these behaviors.
I think you're right. A huge part of it is shifting the conversation from blame and shame to empathy and understanding.
Yeah.
Instead of judging people who smoke or drink,
Right.
we need to create a more supportive environment
Yeah.
that actually empowers them to make those healthier choices.
That makes a lot of sense. It's about meeting people where they are and recognizing that change is a process, not just like a switch you flip on and off.
Precisely, and that process looks different for
Yeah.
everyone.
Yeah.
I mean, some people might benefit from therapy or support groups,
Right.
while others might find success with medication or alternative therapies like acupuncture or hypnosis.
So it's about finding the right tools and the right support system for each individual's needs. But I feel like it goes even deeper than that, right? I feel like we also need to address some of these systemic factors
Yeah, absolutely.
that contribute to these habits in the first place.
For sure, we have to look at the bigger picture.
Right.
Things like advertising, social norms, and access to affordable healthcare.
Right.
I mean, for example, the tobacco industry has a long history
Yeah.
of targeting vulnerable communities with their marketing, and that has a real impact on smoking rates.
Yeah, and alcohol is often portrayed as glamorous and sophisticated in movies and TV shows, which, can normalize and even encourage that excessive drinking.
Exactly. We need to be more critical of those messages and start promoting healthier alternatives.
Right.
We also need to make sure that everyone has access to those resources they need to make those positive changes, regardless of their income or their background.
Yeah, it's about creating a society that supports well-being, not just profits, for industries that benefit from those unhealthy habits. I mean, it's a
Yeah.
big challenge,
It
but
is.
it's one we need to tackle head on.
I couldn't agree more. And I think it all starts with education and awareness.
Right.
I mean, the more we understand about the complex interplay of factors that influence our choices, the better equipped we are to make those informed decisions and create a healthier future for ourselves and our communities.
This has been such an eye-opening conversation. We've gone beyond the surface and really explored that multifaceted nature of smoking, alcohol, and oral health.
Yeah,
It's clear that there's no easy fix,
right.
but there is hope.
There is.
What would you say is the most important thing for our listeners to take away from our deep dive today?
I think the key takeaway is that your oral health is intimately connected to your overall well-being.
Yeah.
By taking care of your mouth, you're investing in your health, your happiness, and your future. And remember, it's never too late to start making positive changes.
That's a great message to end on. We hope this deep dive has empowered you with knowledge and inspired you to take action. Remember, you have the power to make choices that support your health and your well-being. Thanks for joining us, and keep smiling.